Hi guys, happy Friday. Welcome to your Friday Facebook Live. I'm Dr. Greer if you haven't met me. And today I'm going to talk about a new topic, something I've actually never talked about before, and that is CoolSculpt. So I do a ton of liposuction. I've done hundreds of cases and I'm very comfortable with liposuction. I don't normally talk about the non-invasive fat removal methods, and there are a couple of reasons for this. One, most of them do not work. We had Vaser Shape at my practice when I bought it, and I saw a lot of people have it. I didn't really see a whole lot of results. That's not something that I continue to offer after I bought the practice. There are some other methods like CoolSculpt, and honestly I don't remember all of the names, but there's one interesting thing that all these modalities, all these tools have in common, and that is what they're FDA approved for. Venus Freeze is another one that I've heard of. So what's really interesting, if you want to find out information about a non-invasive method of fat removal, Google what the FDA approval is for, because this will get you. So under the FDA, things have to be approved for safety and efficacy, meaning they're safe and they work. Most of those fat removal devices like the CoolSculpt and the Vaser non-invasive, those are FDA approved for things like treatment of muscle pain. I think the Vaser was approved for temporary improvement in the appearance of cellulite. None of them are FDA approved for fat removal. So this is where people get a little sneaky. They get it FDA approved under a device that already exists for an approval, and then they market it for an off-label use. So basically they say, oh yeah, it's safe and it works great for treating mild muscle strains, but we're going to sell it to you for fat reduction. That right there is a huge red flag. And in my mind, if it's not FDA approved for what you're using it for, should you be using it for that? Now, that's a whole little bit different ballgame. Like we use Botox in areas where it's not necessarily FDA approved, like around the mouth, but it's for the same use. The goal is to paralyze muscles. Here, something's FDA approved to treat muscle strain, and it's being used to remove fat. So totally different thing. That's reason one why I really haven't talked about non-surgical reduction methods. Reason two is because the one non-surgical method that really does work, CoolSculpt, I haven't had my hands on yet, but we are getting a CoolSculpt machine. We just put in our order. I'm so excited. We're actually getting two, and I'll tell you in a minute why that's important. So CoolSculpt is FDA approved for the removal of fat, for fat reduction, and over 8 different areas of the body. So that means not only is it safe, but it works. That's what it's actually FDA approved for. I'm sure you've seen tons of TV ads. I know at least a dozen plastic surgeons who have a CoolSculpt and love it because it does work. It's consistent. So CoolSculpt is cryolipolysis. Cryo means cold. Lipolysis means actual rupture of the fat cells. Lipo is fat, just like liposuction. The way the machine works, there are paddles of different sizes, and a little bit of suction holds that paddle to your skin. The paddle cools down and cools down the fat, and then the fat cells actually go into what's called apoptosis. It's programmed cell death, meaning they basically commit suicide. That fat is then sent into your lymphatics and processed by your body. So the fat cells are killed. They're gone. They're dead. They're not coming back. You can still gain weight in other areas, but the treatment's permanent. Now, is it as dramatic as liposuction? No, of course, it's not surgery. Liposuction, I can probably, if this is the amount of fat you have in your stomach, we could decrease it by about 70%. With CoolSculpt, you can only decrease it by 25%, but 25% is still pretty huge. That's by a quarter, right? So if you could get rid of a quarter of the fat thickness over your stomach, why not? Here's the great part. There's no downtime with CoolSculpt. Liposuction is fantastic. I've had it myself, so I speak from experience. But you are sore and bruised and swollen, and the bruising and swelling can last for a month or two. You have to wear a compression garment, which is uncomfortable in the summer, and you have to take it easy. So no working out. If you have a really physical job, you may need some time off. With CoolSculpt, none of that. Nada. You come in, you hang out for a few hours, we apply the paddles, and then you go home and you're done. In terms of discomfort, it's not really like true pain. You know that pins and needles feeling you get when your arm's been asleep? It's more like that. So no pain medications, no compression garments, nothing, no downtime. And that's why it's an awesome treatment. And it works. Now, I mentioned before that we're getting 2 machines. And that is a key point. So I want to talk a little bit about who you should go see if you're interested in CoolSculpt. First, I always recommend seeing a board certified plastic surgeon. And yeah, I'm totally biased there, but hear me out. So if you're dead set on no surgery, CoolSculpt is the only thing I want, that's fine. Go see whoever you want. But if you're not at all sure, I would definitely recommend seeing a plastic surgeon because they can offer you other treatments. You know, if you go to a place that only sells CoolSculpt or only sells non-invasive treatments, that's what you're going to get, even if it's not the best option for you. If you see a plastic surgeon, they can at least educate you about other options and say, well, hey, you know, these are the things a tummy tuck would address that CoolSculpt won't. Or this is the difference you could see with lipo versus the difference you'll see with CoolSculpt. You may ultimately end up having the exact same treatment, but you'll be educated about your other treatment options. And if it's not the best treatment for what you want to accomplish, a plastic surgeon can tell you that and tell you what the best treatment is. So although this is offered in many different types of doctor's offices, I always recommend seeing a plastic surgeon. Second point, I mentioned the dual sculpt. So when that paddle's applied, it sits there for about half an hour and then it's moved to another spot. It used to be longer. It's actually a lot faster now than it used to be. But you may have to reapply that thing 5 times for a single treatment. So if you're doing your abs and waist, that might be, you know, 2.5 hours. And that's kind of a long time. That's a whole afternoon you're out. With the dual sculpt with 2 machines, you apply 2 paddles. So it's half the time, which is awesome. So those are my 2 recommendations. Find an office that has 2 machines and see a board certified plastic surgeon so they can educate you about all the options and not just sell you the one treatment they have. If you have any questions about CoolSculpt, leave them in the comments. I love to answer questions. And remember, I'll be here live again next week, Friday at 3 p.m. And you'll see our little graphic pop up on Wednesday and on Thursday asking for questions. I love getting questions. I love talking to you guys every week. Fantastic weekend, and check us out if you want to learn more about CoolSculpt. Bye.